Good afternoon, everyone. At this time, we'll call the Health and Human Services Subcommittee to order. Colleagues, we only have one agency today, and that agency is the Department of Human Services Administration. And at this time, I'd like to call up Ms. Natalie Andrade to give us the agency report.
Thank you, Mr. Chair. Good afternoon. My name is Natalie Andrade, here with the Department of Legislative Services to present the fiscal 26 allowance for the Department of Human Services Administration. To begin, on page 1, you will see that the fiscal 26 budget increases by $29.2 million or 9.3%, bringing the total to $344.7 million. As you can see, the fiscal 26 allowance increases across all fund types compared to the fiscal 25 working appropriation after accounting for proposed deficiencies. The increase is primarily driven by MD-related expenses for operations and maintenance, as well as salary adjustments and associated fringe benefits. Jumping to page 6, the Managing for Results section begins with an analysis of children receiving appropriate care. Exhibit 1 on page 7 provides information related to the review of cases monitored by the Citizens Review Board of Children, showing improvements in educational services but ongoing challenges in access to physical and mental health services. In particular, progress in physical and mental health services has been slow, increasing only from 42% in fiscal 2020 to 46% in fiscal 24. So DHS should comment on the steps being taken to address these challenges and improve access to physical and mental health services for children in foster care. On page 8, there is an update on the Human Services Careers pilot program that seeks to address workforce shortages by providing scholarships and stipends. The program has faced implementation delays in scholarship disbursements. The high school internship component is expected to begin in spring 2025 in Baltimore City, Baltimore County, and Prince George's County. The college scholarship component has received 111 applications, with 55 accepted, 27 denied, and 29 under review. So the DHS should comment on the use of the fiscal 24 funds, including how much was spent for stipends or implementation activities. Additionally, DHS should clarify whether stipends are funded in fiscal 25 and 26. If stipends are not funded in these years, DHS should explain how it plans to support these costs. On page 9, the fiscal 26 budget includes a proposed efficiency appropriation of $9.1 million for fiscal 25. The largest portion of this, $7.8 million, is allocated to the Constituent Services Call Center contract due to a higher than expected costs. Other proposed efficiencies include $872,000 for legal services expenditures under the Maryland Legal Services Program and $500,000 in federal funds for the Maryland Indigenous Family Partnership Grant. Regarding the call center, DHS should discuss why the total funding for the contract described as supporting that contract in fiscal 26 exceeds the amount that the department indicates it's needed by more than $20 million, and any plans to realign funding for the contract to consolidate costs in one location to provide more transparency for overall funding levels and costs. On page 11, Exhibit 2 shows a breakdown of the fiscal 26 budget. As you can see, the largest portion, $157.6 million or 46%, is allocated to MD-Think, followed by $25.5 million or 28% for personal expenses and $38.8 million or 11% for the Office of Technology for Human Services. On pages 12 and 13, Exhibit 3 shows the key changes in the budget. As you can see, the $29.2 million increase in the budget is largely attributed to an increase of $21.1 million of MD-Think related expenses, including Amazon Web Services, system integration, and software licenses. Additionally, salary adjustments and associated fringe benefits account for an 8.2 million increase. On page 14, the personnel section details a reduction in turnover expectancy from 7.06% to 6.07%, with 63 vacant positions as of December 31st, 2024. While recruitment efforts have been made, 9 positions remain vacant for over a year. On page 15, the key observations section begins with an update on the MD-Think project. MD-Think is a cloud-based platform integrating Maryland's health and human services. While core applications like the Child, Juvenile, and Adult Management System, the Enrollment and Eligibility System, and the Child Support Management System are operational, ongoing development is needed to enhance functionality and address compliance issues. The Department of Juvenile Services has discontinued CJAMS due to inadequate functionality, raising concerns about its future use. So DHS should comment on the implications for CJAMS following DJS's decision to discontinue its use. Certification for the CSMS and the E&E remains pending despite years of operation. So DHS should comment on how certification is being conducted, why certification is still pending despite these systems being in use for several years, and provide an update on whether certification was received. Additionally, DHS should clarify whether CJAMS has already received certification. For fiscal 25 and 26, plan enhancements focus on streamlining benefits processing, improving case management, and upgrading the data systems. DHS should comment on how much of the $157.6 million in the fiscal 26 allowance is for operations and maintenance, and how much is for enhancements to the system. In light of the state's fiscal outlook, DHS should describe why each plan enhancement is essential for fiscal 26. At the bottom of page 16, there is a discussion of the financial overview of the platform. MD-Think expenditures reached $354.8 million from fiscal 23 to fiscal 25. In federal fiscal 24, $116.6 million was spent, with major allocations for Agile Scrum team development, shared platform, and the enrollment and eligibility system. However, discrepancies exist between DHS reported expenditures and state budget figures. For fiscal 24, DHS reported $116.6 million spent, while the state budget indicates $206.5 million. A similar gap happens in fiscal 26, where MD-Think's total allocation is $158 million, yet specific IT projects account for only $65.8 million, leaving $92.2 million unaccounted for. So DHS should discuss the cause of the discrepancy in reported spending and the reason that the fiscal 26 allowance includes such a significantly higher level of funding than DHS reported has been spent in recent years. At the bottom of page 18, starts a discussion of audit findings on MD-Think. A March 2024 audit of DOIT identified concerns over MD-Think's cost increases and delays. The project's budget grew from $166.4 million in 2018 to $588.8 million in 2022, with completion delayed by 3 years. Regarding the findings related to MD-Think, DOIT failed to justify these cost escalations and did not ensure timely resolution of independent verification and validation issues. Initially planned for completion in May 2021, MD-Think's delays stem from contract modification, expanded project scope, and technical challenges. Issues with the enrollment and eligibility testing, the CSMS workflow redesign, and the CJAMS functionality gaps contributed to the setbacks. DHS should discuss the steps being taken to address functionality gaps in deployed components and the challenges encountered during implementation. Issue number 2 on page 20 discusses the new DHS Data Office, which was established to modernize data collection and reporting. While the office aims to improve decision-making with real-time data, DHS has reported challenges with the data accuracy. So DHS should discuss the steps that is taking to ensure data reporting throughout the department is accurate and timely, the timetable for resolving data issues, the impact that data integrity issues will have on the ability of the new office to produce reliable internal and public-facing data, and the cost of the new office. Issue number 3 on page 21 presents a recent fiscal compliance audit that identified a $100.2 million deficit in a DHS non-budgeted clearing account. DHS management was unaware of this deficit until December 2024. DHS should discuss any identified sources to address this deficit, or if general funds will be required, and the efforts that it has undertaken to monitor clearing accounts moving forward. To conclude, on page 23, the DLS recommendation is to adopt committee narrative requesting a report on the cost, implementation progress, and long-term sustainability of MD-Think. And with that, I conclude my presentation, and happy to take any questions.
Thank you, Ms. Andrade. Senator Hettleman.
Thank you, Mr. Chairman. So I read with interest your comments about MD-Think, and in your estimation, where is the accountability for this system?
How the accountability?
This is a lot of money, right?
Yes.
And the functionality is not as we would like it, as detailed in your report. And so I'm curious to know what DLS's perspective is on kind of where the buck stops. Whose responsibility is it to manage these millions of dollars and dozen plus vendors and the fits and starts that this has had?
DHS is the responsible of managing those funds, of implementing the program, and DHS is the agency is the responsible for, as I said, managing the funds, and also to coordinate between agencies with other agencies. I know that they have funds to reimburse the other agencies for the programs that have been implemented in MD-Think.
So it's not DO-IT's responsibility, it's
No,
DHS's responsibility.
It's DHS.
Okay.
DO-IT is like supervising the implementation of the program.
Thank you, that's
DHS.
helpful. Thank you.
Mm-hmm.
Seeing no further questions at this time, it's appropriate to bring up the agency.
Good afternoon, Chair McCray and members of the subcommittee. I'm Carnitra White, and I serve as the Principal Deputy Secretary for the Department of Human Services. We would like to thank Governor Moore, Lieutenant Governor Miller, our colleagues at the Department of Budget and Management, and the budget committees for their support. We're grateful to our analysts for her budget analysis as well. Joining me at the table today is our Deputy Secretary for Talent and Customer Service, Daniel Wade, as well as Pat McLaughlin, who is our MD-Think Executive Director, and Jessica Smith, our Acting Chief Financial Officer. We also have members of our leadership team in the audience, including Stephen Liggett-Creel, who is the Director of the Prince George's County Department of Social Services. The DHS administrative budget includes 4 major budgetary units: the Office of the Secretary, Operations Office, Office of Technology and Human Services, and the Local General Administration. In our written testimony, we've provided some overviews of those. We're gonna focus today most of our testimony around MD-Think. DHS serves nearly 1 million Marylanders annually. Both our customers and 6,000 employees utilize the applications on MD-Think daily. Over 555,000 Marylanders access our system weekly. These Marylanders are seeking information and application for essential benefits. Prior to MD Think, the 3 DHS administrations had individual legacy systems. Beginning in 2020, those legacy systems were migrated onto the MD Think platform. The eligibility and enrollment, the child, juvenile, adult, and adult management system, and the child support system are all supported on the MD Think platform. We use these systems every day to serve Marylanders and issue essential benefits. These systems are how we operate. They're how we do our business daily. Now I'll ask our MD Think Executive Director, my colleague Pat McGaughan, to talk a little bit more about the platform that may address some of the questions that the Senator had earlier as well.
Great. Thank you very much, Karnitra, and good afternoon, everybody. When MD Think was first envisioned, it was considered a finite program, something that would be implemented in 4 to 5 years, as mentioned in the analysis. Today, it's really evolved to something much different than that, which is a dynamic, enterprise-wide digital services platform that's aligned with modern technology best practices. We want to highlight that because we've evolved from something that would end to something that's going to continue to have operational capabilities. We want to think about this the way you would of any other cloud-based service. Think about Google or we use Amazon services, Microsoft Azure, things like that. It does not necessarily come to an end, rather continues to enhance and improve over time. Additionally, this evolution has really accounted for a rapid growth of the number of agencies that are on the platform. When this started, it was just the DHS applications that Karnitra mentioned before. And we're now supporting multiple agencies and significant programs for those multiple agencies. And these include the Department of Health, the Health Benefit Exchange, so Maryland's Health Connection runs on our platform, the Department of Public Safety and Correctional Services, the Department of Labor, and many others. As was mentioned previously, the key thing here is we've been able to shut down these legacy programs and move them onto the platform. And that's the key thing about the platform is at its core, MD Think provides what's called a platform as a service capability. And what that does is it enables organizations to build out, to test, to host, operate, and integrate their mission-driven applications, their data, and look at emerging technologies. Our approach to MD Think allows us to look at ongoing operational changes that are going to meet the needs of our customers and agencies across multiple agencies. We've really spent a lot of time over the course of the last 2 years focusing on building the potential of the platform to really help agencies deliver their mission-specific health and human service benefits and readying the platform to launch cross-agency collaborations on key initiatives. The goal behind these initiatives is to be able to simplify the overall experience for our customers and to ensure that Marylanders are served and that the state is administering services more efficiently. And we've actually already seen a number of examples of this coming to bear, and it includes optimizing costs and also enhancing service delivery, and I'm just going to mention 2 of them briefly. The first of which is the implementation of the Maryland Sunbucks program last summer, which made summer nutritional funding available to 594,000 students. That's an outrageous increase over previously what had been provided. And we were able to do that in just a matter of months. And the reason we were able to do that in just a matter of months is because of the way the platform is configured and the way that we work within the integration of the applications on the platform. The second would be the Unified Benefits Program. This is a new initiative that stood up over the course of this last year. And the driver for this is really simplifying benefit access to Marylanders by asking a number of simple questions and quickly delivering the different benefits they're eligible to that they are eligible for in a mobile, modern, easily to understand way. It integrates the Medicaid, SNAP, cash assistance, home energy assistance, emergency assistance, WIC benefits all into that particular program. We were able to design and develop that within a couple of months. We launched that in the middle of November as a soft launch. and have already to date seen 50,000 plus Marylanders use that to understand what benefits they're eligible for and drastically change the way they see how service delivery can be made. A specific example is when we were testing this in the field before it even went live, we were doing on-the-ground testing with customers in the local offices. We were visiting a WIC office, and during that testing process, we're able to inform that Marylander they're also eligible for other benefits they had no idea they were aware of, or that they were eligible for. So even before this went live, we were able to see the impact felt on Marylanders. And again, it's a testament of the overall program approach and the way we've really changed what MDThink can do to bring services to Marylanders. We've shifted to a real human-centered design approach to the way we deliver these services, and that idea is really focused on the customer experience itself, working with the customers in the field, working with caseworkers to understand more directly what it is they're looking to deliver, and then designing the overall systems around what we're hearing and doing iterative testing constantly to ensure that we're doing the right work for the right people at the right time. And in some cases, this includes redesigning existing applications that don't work the way they should work. These successes have started to change expectations of our customer agencies. One of them is that we start to do things faster. What we've been able to demonstrate is some of these changes that we've long heard, that MDThink doesn't work, that it wasn't built the way we want it to be built, has often led to a feeling that the applications are stuck or not going to work for our customers. And in fact, we can make changes pretty rapidly to address those gaps or the issues that they feel are not being met in a way that delivers the applications to a usable state that's going to help them do their job more effectively. The one issue with the MDThink doesn't work approach is MDThink has become somewhat of a monolith. It really gets seen as a single term with a single budget, but the reality is the program itself supports major administrations and applications that standing on themselves in other states are single entity applications. For example, our eligibility and enrollment program, or our child support management system, or our child, juvenile, and adult management systems. Those three massive programs are all part of the single MDThink environment. In other states, they're separate entities that are managed completely independently. And I think sometimes when we lose the understanding of the difference between those applications, our caseworkers, our programs, and the work that gets delivered often gets somewhat trivialized in that particular process. So I did want to call that out specifically because we're changing this approach as an organization. We want to put the direction of these applications, the ownership of these applications back in the hands of the agencies and allow the MDThink platform to be the mechanism to deliver these, but have the agencies really contain the ownership over the direction, the roadmaps, and the changes and enhancements that they're going to experience over time. We want the agencies to drive that because they're the subject matter experts. They're the ones who are working with their customers in the field, at the local offices every single day, and are really the ones that can drive the positive direction we want to head in. This ongoing evolution includes a lot of operational changes that we've talked about now and have seen elsewhere that are going to continue to require us to make enhancements and changes to the systems. Some of these are legislatively based. Some of them are optimization opportunities for cost optimization or functionality optimization. They often are driven by increased collaboration and the expanded agency participation. As I mentioned before, the Unified Benefits Program, that's a coordinated effort between the Department of Human Services, the Department of Health, the Health Benefit Exchange, and the Department of Information Technology. And we're going to continue to see that type of collaboration when we think about service delivery. So as a result, what was originally projected as a 4 or 5 year finite program to support DHS with a pretty static scope of work has really turned into an enterprise-wide, sustainable, long-term digital platform for the use across state agencies within Maryland. And with that, I will turn it back to Carnitra.
Thank you, Pat. Now we will provide our responses to the DLS analysis. To begin, Regarding the increased access to physical and mental health services, we have some details in our written testimony. I will highlight for you that we've implemented several initiatives and partnerships across to address the enhanced physical and mental health services for our youth who are in our foster care system. These include a monthly SSA health work group, as well as a audit compliance and quality improvement sessions that we have with our local departments of social services, and statewide advisory task force to address the physical and mental health needs of our children. The data that is referenced in the analysis is from the Citizens Review Board, and they have they monitor a smaller segment of our population than we do. We look at the whole population, and in our written response, you'll see some data and some indicators from our headline report. Now I'll ask our Deputy Secretary, Dan Waite, to respond to the next issue regarding the Human Service Career Pilot Program.
Good afternoon, Mr. Chair, members of the subcommittee. My name is Dan Waite, and as Carnitra said, I'll be talking about our Human Services Careers Pilot Program. There are two components of that program. The first component being a scholarship program, the second component being an internship program to introduce high school students to human services careers. As we moved into the implementation of the program, we first concentrated on the scholarship program, given the funding that was available for that program and the need for paying for higher education for folks in the human services careers. As we went into that implementation phase, we realized that there were needs for some statutory adjustments, and we appreciate the work that was done by members of this subcommittee to help us amend the bill to make that scholarship program workable. In partnership with the Maryland Higher Education Commission, our first scholarship awards went out in the fall of 2024. And clarifying one piece, we had 55 applicants who qualified for scholarships and were offered scholarships. To date, 44 people have actually accepted those scholarships. But we are continuing to review applications for a second round of scholarship awards. We are excited to continue this work into FY25 and 26, moving towards the implementation of the internship program. The funding for the stipends is fully funded in FY25 and 26. Our first report on this program is linked to our written testimony. And with that, I will turn things over to our acting CFO, Jessica Smith.
Thank you. Good afternoon. Regarding the DLS question about the call center contract, the increase in the Office of Home Energy Program's OHEP budget of $23 million is not for the call center contract. During submission, we inadvertently labeled a contract with the wrong title in our submission of the budget data. We are working and will work with DBM to make these adjustments in the budget management system. This increase is a technical change to realign federal fund appropriation to spend to the total available funding of federal low-income home energy assistance program grants. Okay?
Great. Thank you, Jessica. So I will answer the questions regarding the implications of CJAMS and of DJS's decision to discontinue its use. So CJAMS, which is the Child, Juvenile, and Adult Management System, is the state's system of record for Title IV-E eligibility, which supports children under the care of both DHS and DJS. In order to minimize the need for manual federal claiming data entry and processing, we are working with DJS to make sure that the system they choose to integrate or to use in order to replace their Assist program will integrate directly with CJAMS to determine eligibility for Title IV-E federal funding for individuals who are under DJS's care. And we'll continue to work in partnership with DJS to ensure that our youth are served. Next, I'll move to the question regarding the MD Think certifications for CSMS and for E&E. So regarding MD Think certifications For eligibility and enrollment, there are 2 certifications that are required. One of them is complete. So the certification with the U.S. Department of Agriculture's Food Nutritional Service was completed in March of 2021. The second is with the U.S. Department of Health and Human Services, CMS, and we were notified in June of this past year, 2024, that we were going to need to certify the system. We have subsequently worked closely with CMS in order to move forward for that certification. We're currently working with them toward that. The review is in progress, and we expect to have that completed this year with CMS. For CSMS, that certification is also in process. There's a 2-phased approach to that particular process, the first of which is called pre-certification. That cannot begin until at least 6 months after CMS or the system is live and in production. So we began that pre-certification process at that point. Over that time period, there is a review of certain functions that need to be required. There's over 1,000 of those. During that particular review period, those functions that need to be updated, changed, enhanced, or fixed are identified or seen as non-compliant. 25 of those were identified and are continuing to be fixed. And we are anticipating the second phase of the certification process to start soon. The second phase is an on-site visit from the Office of Child Support Services. So we expect that too to be completed this year. For CJAMS, just for the record on the third system that we're discussing, that was already found to be substantially compliant with the Comprehensive Child Welfare Information System back in November of 2023. So that certification too has already been met. I'll next move on to the questions regarding the budget and the types of enhancements that are currently underway. So regarding the MD Think budget, we mentioned that the listing of $157.6 million that's in the fiscal year 26 allowance. Actually, only $125 million of that is specific to DHS work. The remaining 32 is actually reimbursable work items for partner agencies, as we mentioned before, Department of Health, Health Benefit Exchange, Public Safeties and Corrections. And then the remaining 125 is for the work to support the DHS programs and the shared platform with which we operate. For the DHS work itself, we anticipate that roughly 46% is for design, development, and implementation work. Those are the enhancements that we're talking about, while the remaining 53% is the standard maintenance and operations to keep those systems running. I do want to call out of that breakdown of the 125, 60% of which is actually federally funded. We work in partnership with 3 federal agencies to provide funding for the MD Think program. And all of that reimbursement is based on a specific match. Each of those federal agencies have a different match rate. So it's not necessarily a one-to-one as we remove or adjust budget to say that it would be a one-to-one removal of that, because depending on the type of work, we get more or less contribution from the federal partners. As I mentioned earlier, and as Karnitra mentioned, the budget does consolidate the cost of 3 major applications, so CJAMS, CSMS, and E&E. And these are typically maintained separately in other states. Because we're using the platform, we actually are able to realize pretty significant cost savings because we've got the shared platform, we can consolidate software licensing, we can share resources across the multiple programs to support the underlying platform as well. And that consolidation of work, or that consolidation of budget and of effort, often, again, it gets treated almost as a monolith, as one single component, when the reality is we're talking about a lot of different applications supported on the program itself. We have a lot of operational changes and enhancements planned for FY26. They're often required to meet regulatory and compliance requirements that are put in place, both from the federal and state governments. But there's also DHS administration requirements that get added, and what we're hearing from our customers. A lot of the enhancements and changes are based on what we're hearing in the field, talking to our customers on what their experience is like. We're also looking at continued increased integration between different systems and different partner agencies. So when we know there are new requirements coming in from other programs, we want to make sure that we have opportunities to have direct integration between those two, thereby reducing manual intervention that currently happens in each of those programs. It also builds standardization, which allows for further trust and confidence in the data that's being exchanged between those particular programs. We provided significant background on the work that we're doing this year. So you've seen all of the work that is planned for for fiscal year 26, so that you have an understanding of the types of enhancements that we are looking to introduce to the program this year. And you can see many of those are related to compliance or regulatory work for both the federal and the state governments. Next, I'll talk about the discrepancy between the reported spending and the FY26 allowance. In the analysis, it talked about the significant gap of 60+ million versus the 157. That analysis actually excludes two major components of the overall budget, one of which is the shared platform. The shared platform is what covers costs for our cloud consumption services through AWS, all of the software on the platform, the resources supporting all of that software, as well as new kind of statewide programs. Unified Benefits is the one I mentioned earlier. That is all considered part of the shared platform. So that was excluded from the analysis when thinking of the entirety of the 157. Likewise, those external partners, so reimbursable funds that are coming from agencies like the Department of Health, Health Benefit Exchange, Public Safety and Corrections, and others, are also account for 32. So when it mentioned there was a need to explain the gap of 92 million, that's actually the gap. It was the shared platform costs and the external or reimbursable costs that are associated with our budget. Regarding the question about functionality gaps in deployed components, all the applications that are on the MD Think platform are in production, used daily, and support over 2 million Marylanders. As mentioned earlier by Carnicia, we have roughly 500 customers that use the system on a weekly basis. We support over 2 million customers between the DHS directly supported Marylanders and those other agencies that are on the platform, like those accessing Maryland Health Connection or Medicaid or many other programs. In 2023, we performed a significant organizational shift or shift in the model with which we manage our applications. We've shifted to a product development approach, and that allows us to be more direct in how we go through concept development, design and prototyping, and testing so that we're driving those application enhancements more effectively. Our written response goes into detail of this approach, but really the idea behind this is that we do a lot of the significant planning and the iterative work so that prevents functionality gaps that may exist once it gets out into the field. Sometimes that does occur though, and what we've been able to shift our approach around is our overall organizational model of the work that we perform. We use an agile model that allows us to break it down into smaller chunks of work to iterate through. And because we now have 2-year roadmaps that the agency administrations are all helping to drive and enforce what's going to get performed, it allows us to provide an easier window into how we fix some of these functionality gaps that may come up from customers in the field, from caseworkers, whoever it may be, and quickly address those issues in near real time, within weeks following their identification. We've seen a significant improvement in the overall issues that were identified over the course of time with the different applications. In fact, we've seen a roughly 60% reduction in defect creations. So essentially when someone sees something that doesn't work the way they anticipate it to work, or it doesn't, it's glitchy or something is going wrong, they can log a defect or a bug with us. And over the course of the last 2 years, we've seen a drastic reduction across the entire program in that. And that is a testament to the changes in the overall model with which we organize the program. Lastly, I'll provide an update on the question about the report on costs, and that just simply is we concur with the request regarding the report on costs, and we'll provide this report. We do respectfully request the due date move to December 1st of 2025 in order to ensure we have an accurate reporting and align with federal reporting. As I mentioned earlier, 60% of our funding does come from our federal partners. All of our funding is approved through advanced planning documents, and those all operate on a federal fiscal year, so October 1st through September 30th. So that report will have much clearer alignment with the overall fiscal nature of the program if we report in December. So with that, I'll turn it back to Karnitra.
Thanks, Pat. And now I'll address the issue around our data office. Over the last year, we've renewed our commitment and our focus on ensuring that any public-facing data is consistent, validated, and comprehensive. In our data review, we found that we had antiquated manual data creation of reporting processes that we just couldn't have confidence in. We just didn't have the confidence in those processes that we had. And as we uncovered these challenges, we began to rebuild our approaches to reporting out our data. So just like with our work with MD Think, we've focused on restoring data integrity and validating all our data since January of 2023. The work that we're doing in 2024, the work that we did in 2024 laid the foundation for the continued work that we will do, including basic training on data standardization across all of our department. We believe that data integrity efforts in 2025 will ensure that data can be made public via our dashboards, and that's part of the work that our data office is doing so that we can be reviewed and have future and be further reviewed and improved in the future. And I will note that the implementation of our data office was done with within our existing administration budget, and we will officially adjust the budget subprogram in the 2027 budget requests. And with that, Jessica will address the next two issues.
In response to the $100.2 million non-budgeted clearing account, we anticipate that reconciliation will be fully complete by the closeout of fiscal year 2025. And to do so, we will review the fiscal year 2024 year-end non-budgeted clearing account and will process any journal entries to eliminate these deficits. As stated in the 2024 closeout review, the system reports depict a positive net balance that will offset the negative balance. The Comptroller's General Accounting Division confirmed the availability of the special funds from the fiscal year 2024 closeout sitting in a non-allocated account, and the expenditures will be reported against these unallocated special fund balances. And as a result, general funds should not be needed to resolve this issue. As next steps, we will partner with DBM to review the fiscal year 2024 non-budgeted clearing accounts, and in fiscal year 2025, clearing accounts are being closely monitored to ensure proper reconciliation of the expenditures and revenue posting. And finally, in regards to the MD Think reports that are being requested, as mentioned previously, we concur with this request, but we request a due date of December the 1st, 2025. Thank you, and we look forward to your questions.
Yes, that concludes our testimony.
Thank you, Madam Deputy Secretary. Senator Zucker.
Thank you very much, Mr. Chair. Great to see everyone. So when will we know, so tell me again, this $102 million that went into the non-budgeted clearing account, when will we know for sure that it's not going to need to be resolved using general funds?
We know for sure now.
Okay, we know for sure.
It's just it's the technical changes that need to take place so that our reports are clear. That's what we're doing now.
Okay. All right. Thank you.
You good? All right, Senator Adelman.
Thank you very much, Chairman. Can you explain to me, and I'm honestly new to some of getting into the weeds on MD Think, and I appreciate knowing about how smooth things went with Sunbucks, et cetera. And I appreciate the explanation of how the project has changed over the years and evolved to being a omnipresent entity within state government. But one of the things I'm confused a little bit about is kind of the role of the agency compared to Do It, for example. And you articulated that you want to be a more, I'm going to use not the right terms, but a customer-friendly service, and that you are looking to have agencies drive ownership and respond to the agency's needs, which seem entirely appropriate to me, and obviously how our constituents need to use the system, and how the agencies need to respond and integrate with other systems, federal, et cetera. So I guess I'm a little confused by two questions, I guess, here. One is, do you have then the professionals in each agency to be able to be your liaisons on the ground and to be able to do the heavy lifting for that each unique agency that you need? Because you don't have unlimited resources and you can't be everywhere all the time. And what is the role then of Do It in all of this?
Like we do. Okay, great. Yes. So in order to support this, the agencies do definitely have to be able to have access to the right skilled leadership, technical resources in order to support that type of work. In many instances, it already exists. For example, the Department of Health has already transitioned a lot of their work to be directed, led, and developed by their own teams at the Department of Health on the platform. Same can be said for the Health Benefit Exchange. They're also following that model. The reality is, in some cases, other agencies are not quite there yet, and we're working with those agencies to help build up that muscle to be able to eventually take on ownership of and direction. What that means is starting with the highest level of leadership, the CIOs that are within those organizations, and then also looking at different structures within their teams. For example, having leaders who understand product development and what that means, but also working closely with, for lack of better kind of a term, the business of the actual agency itself. So it's not just something that's just technology driven, but rather a partnership between those business entities and the technology leadership. As far as the individuals who actually would execute the work, there are multiple options in order to get there. In our case, within the MDThink platform right now, supporting the agencies that we're actually doing development work for, that's through contractual or staff augmentation work with contractors. Do It has stood up the Maryland Department of Digital Services. They also are now a new vehicle to work with in order to help build up some of that muscle to help support this type of work so that those agencies can take on that ownership. Or agencies may have vendors that they work with or staff internally that they're used to working with and would want to use. So there are a couple of different avenues to get there. But it is something that will take us a little bit of time to continue to build that out across other state agencies that aren't currently in that position.
So I guess if I could follow up, Mr. Chair, I'm still confused as to who is driving this process and how that coordination is happening, right? Because I don't think we want to have duplication of effort and waste of money here.
Right.
And so who is the overseer of it all?
So MDThink is operated by the Executive Steering Committee. The Steering Committee consists of the Secretaries of the Department of Health, Human Services, Do It, Public Safety and Corrections, Juvenile Services, DBM. And that group collectively are working toward this. So we're working in incredibly close partnership with Do It on kind of directionally how this all fits with not just their oversight responsibilities, but the broader concepts around building up that technology leadership role. What are the right contractual vehicles to use in order to get there? How do we ensure that there are the right technical resources within the agencies to support that? And that's the approach of that collaboration around having the right kind of leaders at the table to make the decision to drive these initiatives forward is the approach we've been taking. And that's what's helped shift this model. As I mentioned previously, the MDThink team was really responsible for all of this work, and we're trying to shift that, and that shift has been driven by those leaders at those agencies who are looking to have a little bit more ownership of the work that's being done on their behalf.
How often does that group meet?
So we have a monthly meeting that is the official meeting that occurs the first Monday of every of every month at the post office. And then the leaders of the Department of Health, Human Services, DO-IT, and myself, we meet officially every Tuesday morning at 7:30 for a call. And then throughout the course of the week, I would say probably 5 or 6 other times through collaborative efforts. We're working incredibly closely on all of these different initiatives. The reason those 4 or the 3 agencies and myself are meeting so frequently is because of the amount of work that those agencies are doing on the platform. And then what I neglected to mention before as part of that subcabinet, we also include the executive director of the Health Benefit Exchange because they're also a major partner on the platform as well. So they're part of that group as well.
Thank you. I think I'd like to follow up offline to get some more details,
Sure.
but I appreciate the information. Thank you, Mr. Chairman.
Thank you, Senator Hedelman. Just one question, Madam Deputy Secretary. In the last year analysis, they spoke to 13 positions that were vacant longer than a year. Just want to confirm that none of the 13 are currently none of the 9 that have been vacant for longer than a year.
I don't know.
So first, I guess we would have to go back and check the 13 prior ones against the current 9. So I don't know for certain of that. One thing I can say is going back to January 1 of 2023, overall throughout the department, we have reduced the number of vacancies that are 1 year old or more down from 212 to 91. So we've actually reduced that number by 120 over that period of time, and we are very focused on continuing to reduce those vacancies that are over a year old.
I got it. I'm focused on the long-term vacancies of over a year. If you can get with Ms. Andrade and just let us know the classifications, but also more importantly, the time frame in which obviously we know it's more than a year, but like what's the time frame and if any of the 13 are incorporated in that 9?
We
That
will.
would be helpful.
We'll follow up with you, Senator.
Colleagues, seeing no more questions and seeing no other witnesses for this respective agency read, I just want to lean in and let the leadership team of DHS know. Thank you for what you all do for the state of Maryland. We look forward to continuously seeing you for a number of other budget hearings. Ms. Andrade, just wanted to lean in and also say thank you for the work that you do, and we will follow up. Thank you. Y'all have a blessed day. See you tomorrow.
See you tomorrow.